Paul Applebaum and others described this notion of the therapeutic misconception, writ small in a sense, because it was one person's thought that they were receiving, personally designed care as part of a clinical research project. And that's sort of, a rough paraphrasing. It was more elegantly, described in the articles that have been previously published. But I think that we are still grappling with how you communicate about research to individual patients, to individuals. And I think that as we move toward learning healthcare systems and we think about learning from medical care that's delivered, especially through big systems, that whole notion of therapeutic misconception is now going to sort of be writ large, if you will. People will go to hospitals and perhaps not understand how their data or their biospecimens are being used. Or they'll think that information is going to be, the information obtained is going to be funneled back to them directly during that particular, medical interaction. Whereas it may eventually be of benefit to them, but more so to us on a societal level. And so I think that how we communicate about that, how we educate the public, which I think is so critically necessary, and how we develop trust, really, between people and medical institutions, physicians, nurses, the healthcare system, is essential. And I think it's essential particularly now because medicine has come so far away from the Marcus Welby type of situation where you grow up knowing your physician watches you grow up, or you have an extended relationship with that physician and you develop a sense of personal trust that individual has your well-being as the primary directive. And now that we've depersonalized medicine, I think, very unfortunately, that kind of trust is not necessarily integral to the relationship between the healthcare practitioner and the individual. And I purposely don't say healthcare provider, because I think even the use of that term healthcare provider essentially relegates medicine to a consumer paradigm, which I don't think it should be. So how we retain that sort of personal relationship between the system and then the practitioners and the individuals, I think is essential, but it's going to be a challenge. And I think it spills over into research ethics, because I think there will be a blurring of the boundary between research and clinical care.